Hi, everyone. We're going to go ahead and begin our webinar for today. So good afternoon and welcome to our third episode of the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman and I'm your host for today's webinar. We're going to touch on a couple of housekeeping items before we get started. I'm going to roll through this pretty quickly so we can go ahead and get going. First, this Zoom session will be recorded. We'd like to know who everyone is, so please ensure your name is accurate in the panel. If you need help with this, please reach out to us using the chat box feature. I'll be moderating this session with my Phelps Health marketing colleague, Hillary McCash. So one of us will be sure to help you if you do need it. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please go ahead and turn on your video. You can see that myself and Brendan already have our videos on. Please note that each of you is currently muted. If you have a question that pertains to the topic being discussed, please add the question to the chat box and we'll try to get that question answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the entire group or to just one person. We would encourage you to submit your question or questions and comments to the whole group so that everyone can participate in the discussion. However, you are welcome to post a private question or comment if you feel more comfortable doing that instead. We also want to encourage everyone to utilize the reactions that Zoom offers during today's webinar. You can use a hand clap, thumbs up, thumbs down, etc. to let us know if you like, love, agree, disagree with whatever we're discussing. Reactions can be found in two places, one on top or bottom of your screen, and you will see whenever you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation. We will be conducting a couple of polls throughout this Zoom meeting so that you'll get a chance to interact then if you choose. And of course, don't forget the chat feature. Some of you may be using a mobile device while others are using laptops or computers. If you find that your features are not the same, we ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please use the chat box and one of our moderators will be happy to assist. Before we dive into our live walkthrough of MyChart, which is super exciting and it's Phelps Health's new patient portal, I want to introduce our MyChart expert for today. Brendan Williams is an Epic analyst with Phelps Health. He's been with the organization for over half a decade, and he's going to walk through some of MyChart's features and answer any questions that come up along the way. So welcome, Brendan. We're super excited to have you.
Thank you all. Have good afternoon, and I appreciate you inviting me to come to your show today to demo some functions of MyChart and answer some questions from the community and kind of help to teach and inform.
Yeah, we're super excited. So before I hand the reins over to Brendan to just dive in, I want to go ahead and ask a polling question before we get started. Let me go ahead and pull that up for everybody. And I'll give everybody a few seconds to answer this. And again, these are all completely anonymous. We just kind of want everybody's feedback before we dive in. Give it about 4 more seconds. All right, awesome. So it looks like we have almost half of people who haven't used or signed up for MyChart yet. So Brennan, it looks like we're going to have a pretty interesting webinar today. So I'm going to go ahead and stop sharing
Great.
this. And I'm going to stop sharing my screen as well. And Brendan, I'm going to go ahead and hand it over to you so that you can walk us through some of MyChart's really cool functionalities.
All right, perfect. Well, I'm sharing my screen out with y'all now. I'm going to move the video window over here to the side so it's not covering up the screen. There we go. So I'm currently logged in here as one of our patients in a testing environment for MyChart. And this is kind of the landing page you'll land in when you first log in. So a lot of information's here. So kind of top and front here is the most recent things that you've seen when you logged in or when last time you had a visit. So in this case here, I can see I have a new test result available for a test. I can click here to also see more about that. I can see I have some tickets to schedule appointments that were given to me by my provider. I can see I had a visit on November 3rd, and I can kind of go back here and look at a summary of that appointment. I can read the note from the visit, look at the after visit summary. I have some questionnaires that my providers have given to me to fill out, so I can click here to quickly fill those out. As well as if you have healthcare systems elsewhere that utilize MyChart, you can link those together. So in this case here, I have another one of our testing environments linked, but you can see I have a button to link over to that because I have two different notifications available there as well. Kind of some other neat things here on this landing screen is if you have family members with MyChart and you're connected to them as a proxy, you can see their stuff too at a high overview. So here I can see in the case of this patient, we can see that their daughters had an appointment recently. We can see information about that, as well as she has a questionnaire to complete from that. So kind of just a quick overview of the home page. And this was all dynamic. As you take actions on these items, they'll disappear. So if I click to view results, it'll take me strictly into this lab result here. And I can see on this lab when it was ran, the results for it was here. I can click to learn some more about it up here at the top, as well as if I have questions about it or something's not right, I can, put a request in to get a correction made on that. And if I go back to the home screen by clicking our MyChart logo at the top here, you'll see that now this has now disappeared off the home screen since I've taken action on it. So this will dynamically update as you receive stuff and take action on different items. So as you kind of click through, there is across the top, there's 4 major buttons here. So the first one is our visits button. And if we kind of take a look at that, this is kind of the home of all of our previous visit information. You'll see hospital admissions, you'll see office visits, you'll see lab testing, all of that right here. As well as if you had anything scheduled, you'll be able to take action on that from here too. You'll be able to see when it is, who it's with, where the location is for the appointment, as well as complete some functionalities called e-check-in, which lets you complete some of your documentation ahead of your visit. So if you wanted to, verify your insurance information on file, update your medications, check your allergies, all of that. Then when you get to your appointment with your provider, they'll have that stuff already available to them. So it'll save you a little bit of time when you're in the office so you can focus on what you're actually there for and less of that intake, as well as you'll have a chance to review that when you have time. So you can, go through there and say, oh, I'm not taking this medication anymore. Let me go through there and update that. Or I'm not taking this dose anymore. It gives you a chance to kind of think ahead of time before you go to your visit and work your way through it. And then after your visit's over, you'll be able to see your after visit summary here, as well as any notes from the visit. So if I click here on this after visit summary from July 29th, I can go back and I can see what was discussed during that visit that day. So we just gotta wait for it to load here for a second. So here I can see my provider gave me some information about what I was visiting them for. I can read that information from here, as well as I have links that jump out to different items to learn more. And if you work your way through here, you can see images were embedded into this document, as well as you can see medication changes from the visit. You can see what was sent to the pharmacy, when your next follow-up appointment is, as well as, other information such as, your blood pressure and your weight and stuff during that visit. And then if you work your way through here, we have this also in Spanish because this patient here, they speak Spanish. So we pull everything in a Spanish version as well for them. And we'll just work our way down to the bottom here. So that's kind of the AVS, the after visit summary that you get at the end of an appointment. You can get a printout of it as well as in MyChart to go back and reference. And if I return back here to this page, if I load some additional appointments here, and I can go back, and if I have notes from a visit, I can go in here and I can read the note that my provider wrote. I can see the information about it as well. That's something that's available to you in MyChart from the Visits tab. So some super, helpful information there. You also have the ability to schedule appointments. So if I click to schedule an appointment here, we'll jump out to this location. And I can see various different pieces of information. So there's a lot on the screen right now, but I'll kind of break it down here. So the first thing we're seeing at the top is because right now we have COVID-19 going on, there's just a little bit of information about that, as well as a link out to some of our different tools that we have to kind of help you to find what the appropriate care path is to take, be it, an office visit, to follow up, with your doctor through a message. We'll kind of guide you through that using some of these different tools here. I also can see here that my provider I saw wanted me to take a couple things to do after the fact from our last visit. So they gave me what are called scheduling tickets, which are easy things to take action on. And when I click on schedule now on this, it's going to take me through questions related to that, as well as picking a location to schedule it with and a time, and let me get that onto the schedule of the provider. But then from here, I can also see providers that I've seen previously, as well as pick a reason for seeing them. So we're going to go ahead and schedule a visit today. So we'll step through with here, I'm going to schedule with Dr. Abashan, and I'm going to say this is a new problem visit. So from here, I'll be able to pick a date. So say I want to see him on the 10th, between the 10th and the 12th. And we'll say anytime it's available, and we're just going to say new problem test. And then this will send a message for the provider's office to work with me to schedule that appointment. And then if I go back, let's see, let's go back to our schedule appointment. So some other tools that are available here too, you can also start this by picking the reason why and then pick a provider afterwards. But we also have this ability to find a new provider. So say you're trying to establish with a PCP for the first time, we could use this tool here and we can click on to find a new provider, and we will see, based on our location, we will see the closest providers to us for these various different specialties. So we'll say family medicine, and we'll see which ones have appointments closest to us available. So I can see closest to me right now that Barbie Fulton has an appointment available at 8 a.m. on Friday, November 6th. So I can select that time, and I can say new patient or something like that, why you're wanting to see the provider and what you can plug in there. And I can go ahead and schedule that appointment with the provider from here. And so this is kind of what I was talking about once you have a scheduled appointment, what you can do. So you can confirm the appointment. So will just cut down on messages, notifications, reminding you of an appointment coming up. I can also, if I have any copays, I can pay my copay ahead of time, as well as I can complete e-check-in, which is a super awesome tool. So with e-check-in here, you can quickly update your demographic information, such as your address, your phone number, your email address. If everything's good though, we'll just go ahead and say it is, and we'll continue on. And then you can take a look at your insurance information. You can make updates according to that. You can add in a photo for scanning. And then if we have a copay, you can make that copayment here as well. It'll offer it to you. And as you can see, I actually just got a notification saying that, hey, I have a new appointment that was scheduled, with a message letting me know. So, and then from here, we'll continue on. You have a chance to review medications, review your pharmacy that you have. You can add additional pharmacies, request medications be removed. You can add in new medications. And then you can see here when I asked like for this one to be removed, it just dropped it down here. And I put a reason why I'm asking for it to be removed. And then once we carry on, you can see allergies and so forth. We'll just continue kind of through that as well. We can see problems. And if you had any kind of trips outside of the country, you're able to document that for travel screenings. And the way this kind of works, if I click on this, we'll have a chance to, we can say I went to Canada, if I can spell Canada. And then I could say I went, to Canada, which right now is probably not likely to actually happen. But if I said I went on 11/1 and I came back on 11/2, and then you'll see that that populates up in here with the date and how many days. And then we'll have any kind of questionnaires, and these will vary depending on the appointment. So we're asking every patient right now some various different questions around COVID-19. So I can go through and answer these questions. But then from here, depending on the provider, why you're seeing them, you may see additional questions asked, such as, like if you're just going to orthopedics, you may get a survey about knee pain, for example. Or if you're in family medicine, you may just get a general reason for visits like this one here. So I'll say sore throat, and you'll get various different questions asked to you. And what this will do is it'll help pull this information together. So when you see your provider, they'll have this available to them to pull through and help them to document and find out, and based on what you describe to them, kind of help them to determine what the best treatment is. So it's a very helpful tool for both your provider as well as you, because like I said, it gives you an opportunity to think about what you're putting in the information there and work your way through it. So as we complete all this, then it just gives you a chance to summarize this information and review and make any changes from there as needed. But I will save us some time because there is actually quite a few questions still to answer on this particular one I did. So we're just going to go ahead and continue. So then back here on our main screen, now that I have that appointment, you can also see here, as I mentioned, this new card indicating that I have a new patient appointment at 8 a.m. and here's the information on it. So kind of the next major tab across the top here is our messages. So if we land in messages, you can see all the different messages that you've received. In this case here, I'm really bad about deleting messages. So I just have tons and tons and tons of them, all mostly about appointment reminders. But you can click on these and you can see information about it. And then I can, in this case here, I can't reply to this one, but if I had one like here from, my doctor, I could reply to that, and then I can delete them when I'm done with it. I can also, which is probably the more useful thing here, is ask a question. We'll click on this button. It's going to ask me which organization, since I have multiple healthcare organizations linked in MyChart, that I want to send this message to. And then I get asked a couple different topics. So I can request a medication refill. I can ask a question about billing, insurance, non-medical type stuff. Or if I had a medical question, I can also ask that. So we'll go ahead and do a new medical question. And then from here, it's going to pull in your providers automatically onto this line that you have on file. If you have multiple providers, you'll have a drop down available to you to pick which one you want to route the message to. And then in this case here, I get a few reasons why I'm sending this message. So I'm going to say it's a non-urgent medical question and sending a message. I also have the ability to attach images. So I can click on this button here and quickly bring up a file picker, and I can pick an image. Or if I'm on my phone, it'll also open up the camera app where I can take a picture with my cell phone and attach it to this message. So then once I hit send, that message will send off. At this point, your provider will receive a notification that they have this new message, and then they'll take action on it appropriately. So our response time is around 48 hours at max, although we do strive to keep it within 24 hours. So that is kind of a couple things around messaging. And then, so moving on from there, like I mentioned, there's different topics available here. So you can click on customer service question. Say you had a question around, a bill or something, you can enter that question in and then send it as well. And it'll go off to our central messaging location, and then they will route it appropriately from there. So kind of going back here then. So if I jump over to test results, this is the next big tab across the top. So we kind of looked at this a little bit ago with like this glucose test here. We looked at the results on it, but you'll see other results as well as like here's this ECG report for this patient, and you can see who it's from, like who ordered the test. And this little E here indicates that this was completed at a different organization. And if I click on one of these tests here, actually this is not a good one to click on. If I click on like this test here, I can then see the report from that test, as well as if there was any past results for that type of test, I can click on that and I can see the past results and then click into reviewing those from right here within our table. So then going back to the main screen here in our test results, once you look at a test, it will turn to this gray color. When it's new, it'll be lit up. And then you can also, as I had mentioned, you can also learn more about a test by clicking this link here at the top. And then if your provider entered any kind of information to share with you, it'll also show up in the screen as well. Moving to the last of our big buttons at the top here is our medications button. And on this tab here, you'll see all the medications that you're currently entered in on. You'll see in this case here, the medication I requested to be removed earlier. I can also add in a personal note. This is something that only you're able to see. So you could enter in, need to request this refill by this date because I'm going out of town or something along those lines. You have the ability to do that from here. You can also request refills. And this is like I said, this is one of our testing environments, so not everything is configured. But once a medication is prescribed to you after October 1st, you'll be able to go in here and check the box on it and then it'll send a message to your provider's office that you're needing a refill. You can also check this box here at the bottom and enter in additionals. So if you have something that you were taking prior to 10/1 and hadn't been prescribed to you after that date, you can go in here and request a refill on it as well, and it'll route to your provider's office. And then, and then like I said, overall here on the medication screen, you'll see how many refills are available. You can click the same thing with the learn more to get additional information about this medication. You can see who ordered it, which pharmacy it was sent to, as well as click this little map button here, and you can jump out to get directions to that pharmacy. And then, so that's kind of the major tabs across the top. So I'm going to take a break for a second and just see if there's any questions or anything from our panel before we kind of jump into some other topics.
Perfect. Awesome. Thanks, Brendan. We do actually have quite a few questions that came through. So one of the first ones I'll ask, because you just talked about like test results, was regarding COVID-19. If somebody gets a COVID-19 test, will their results be conveniently available on their phone through MyChart as soon as they're ready, or how does that process work?
Yeah, so with COVID-19 testing, we have it set up in MyChart where as soon as your result is available to us, it will be available to you as well. So if we get the result back at 3 o'clock in the afternoon, you'll also receive it at 3 o'clock in the afternoon. It can be a little inconvenient at times because we do receive results 24/7, so you could potentially get them at 1 a.m. as well if they're available then. But as soon as we receive them, you will receive your test results as well.
Great, thanks. We had another question too. Why did Epic, whenever this transition happened on October 1st, why did not all of everybody's medical information come through?
Yeah, so we as an organization are kind of taking an approach of bringing over certain pieces of information into Epic, and then there's certain pieces that we reference in our old medical record system. And over time, we'll work on bringing that all in and updating information accordingly. But really, a lot of it is just kind of housekeeping and preparing ourselves to have a more complete and up-to-date record and not having outdated information. So we did there's some stuff that we don't have available directly in Epic, but we do have access to it still. And then over time, we'll move that information in as well as you visit with your providers and stuff along those times. There are some additional items though that will not be available in MyChart. So such as if you had a test result prior to the last 365 days, those won't be available in MyChart. But for now, those are available, and we do have the access to our ECW portal. So Helo is still available, access to that, as well as our mHealth Meditech portal from previous system as well. And then all medical records, though, are still always available through HIM. So if you find yourself in 3 years from now needing test results, you can always request those through a medical information release.
Fantastic. So we're not losing our information, it's just in a different spot.
Correct. Yeah, it's more just a housekeeping. So what you're seeing in MyChart is most up to date information, and then everything is still historically available, though.
Great. Awesome. Thanks, Brendan. We had some more questions too. If you don't mind, we'll just kind of run through some of them.
Yeah,
Is there a fee to use MyChart?
there is no fees to use MyChart. It's completely free. So you can sign up for it as soon as you have your first visit with your provider. You'll receive an activation code from the front desk there, as well as if you don't receive it, then when you leave on the after visit summary, we kind of took a look at it a minute ago. It'll also have a code printed on the bottom of it for you to sign up for MyChart.
Do you have to have an activation code to sign up?
Not necessarily. It's a lot easier if you do because it'll save you some time as a patient. We're not having to go and complete a long form. But if you don't have an activation code on our main page here, I'll log out real quick. There is this sign up now button that you can press. This is the same button you'll use if you have your code. So if you have a
Okay.
code, you plug it in here. But if you don't have one, we can press this button here and you're able to provide information to verify your identity. And then from there, you're able to sign up after that. If for some reason, when you fill out the form and it doesn't make an identity verification, you'll receive a message informing you that we got that information, we received it, and we'll get back with you as soon as possible to get you activated and signed up. So you do have a couple different avenues you can take to signing up.
Fantastic. Yeah, I actually chose the long form way because I did it before my annual wellness exam because I was so excited for my chart. And I think it took me less than 2 minutes probably to fill all of that out. It was very, very
It
easy.
it is. I actually signed up that way myself too. It does. It takes, like you said, less than about 2 minutes to sign up that direction, and you get access right then, which is nice.
Yeah, no, it's super great. I know we were all very, very excited from a healthcare perspective to log on and see what it looked like.
Mm.
So, what about proxy accounts? Are those available within my chart?
Yeah, so the proxies are available within my chart, and the way it works. So actually, this is a great kind of a segue here. So as I had mentioned here on our home screen, so our patient here, Avery, she has a daughter named Emma that she has proxy access to. And you can see that here on the home page, as well as up here in the top right, you can switch quickly over to that family member. So now if I'm here as Emma, it's when I send a message, I'm sending on behalf of Emma. Or if I'm scheduling an appointment, scheduling on behalf of Emma. That's all available right here. As you kind of can see too, the colors change a little bit to indicate that I'm, here in Emma now. I can see the care team has changed from Avery's over to Emma's provider. And then that's kind of a couple things there that are right there in the system. You also have the ability to give proxy access. So if I am an adult and I want to give my spouse proxy access, for example, I'm able to go over here to the Your menu, and then I can go to the searching is probably the easiest way. There is buttons available here in the list, but if I just type in proxy, I will get this share my record here, and I can click on that. And then you kind of have some different buttons here. So the first one here is to share with friends and family. So if I click on this, then I can see who has access, whose records I can access, as well as I can invite someone else. And then from here, I can plug in their name, their email address, and I can pick a type of access. So this is for adults giving another adult access. For access, if you need access to a child's account, for example, or a teenager's account, when you're at your doctor's office, you'll be able to complete a consent form there in the office, and they'll be able to set the access up for you right there that day. So there's a couple different routes, as I had mentioned. For adults, sharing with adults, it's super easy. And then for children, there is a little bit of extra steps just to make sure we're following proper protections, getting consent forms filled out, that kind of stuff to meet some legal requirements.
Awesome, great. So that kind of brings up another question. Is there an age restriction for using my chart or having it?
Yeah, so MyChart, it's available to anyone, but you can't actually sign up and start utilizing it until you're 12 years of age. Before that, though, all of your information is still collected and it's there. So when you do get access at 12, you'll be able to see, growth charts from, pediatric visits. You'll be able to see, vital signs. If you were if you were ever admitted to the hospital for a surgery or something, you'll be able to see that. That's all historically available to you once you sign up for MyChart. But yeah, age 12 is the minimum to actually sign up. And then, yep.
Fantastic. Thanks, Brendan. So we had another question come through as well just now. If somebody has never been to Phelps Health for any type of healthcare service before, can I use my chart to schedule my first appointment?
Yeah, so you actually do utilize MyChart, but not directly in that case. There is a tool that we kind of touched on with the provider establishing care. So if I go into visits here real quick, and we went back here. So this tool here is available on our website. And I'm getting this pop-up right here. It's just asking me if I want to allow the website to get my current location so it can suggest a provider closest to me. And then I can say locations near me from there. So this is available, this portion on our website. And you're able to say, location near me, family medicine, and then you're able to pick that provider and establish care. So if I want to just schedule here with Miriam and I filled this out. So at this point, what you would see if you weren't a patient yet is you would see some additional boxes pop up. It's going to collect some information like your name, your date of birth, your social security number, your phone number, address, insurance, just some basic registration information. And it'll go ahead and schedule that appointment. So you get put on the schedule. They have some of that information. So when you do arrive, it's not as much paperwork to fill out, but you're also able to still schedule ahead of time. So that is a great question. And that's a tool that's available on our website where you'll be able to find those providers.
Super cool. That's awesome. So how secure is MyChart? Because we're using it on like mobile devices and stuff. Is it still very secure?
Yeah, so MyChart is it's got industry standard encryption and security technologies around it. You do have the ability. So you set up your account with your password, and if you are interested in two-factor authentication, which is where you would receive like a text message or an email with a little like 5 or 6 digit code to plug in, you do have the ability to set that up. So if I went over here to your menu again and I typed in security settings, you'll see this drop up right here, and we'll click into this. And then from here, I can update my password as well as turn on that two-step verification that I had mentioned. So I'll see here, I'll see my email address, my phone number on file, and then I'm required to enter in my password. And at this point, then I can say, how do I want to verify my identity? Do I want to do it via a text message to my phone or to an email to my email address on file? And after that, you'll receive that code to sign in for each new device, and then you're able to remember it for I think 30 days is the remember period. So that's available to you right there as an additional security feature.
Fantastic. That's something I didn't know. So super great question. What about e-visits? Because of COVID-19, a lot of people have chosen to take their patient visits virtual. Does MyChart support that?
Yeah, so telehealth is fully supported here within MyChart. So the way it will work is when you have a scheduled telemedicine visit with your provider, you'll get a notification saying, you have a new appointment on your schedule. And then for telemedicine, you are required to do e-check-in to go ahead of time since you won't actually be in the office. So that's a requirement. So it's for us to collect, your up-to-date information. And then 30 minutes prior to for your visit, you'll be able to click a button that says begin video visit. And at that point, it will launch a separate web page and it will take you into a little test that'll ask you, can you test your microphone? Can you test your speakers? Can you hear us? And it'll just have you test all of that. And then once you're past all those tests, it'll drop you into a waiting room. And at that point, once we connect on our side, you'll get a incoming message saying new call from, and it'll say, the nurse's name or the doctor's name who's calling you. And you'll be able to click accept, just like you would like any other telephone call on your cell phone. And you'll be brought into the video session with us. And if you have family members who need to join at that time, we can also send them a link to bring them into the video session as well if they're not in the same location as you.
That is super cool. So something else that kind of comes up is with surgery or appointments, post that surgery or that appointment, and you kind of mentioned this before at the beginning of our webinar, can patients access their doctor notes and follow-up treatments on MyChart? And whenever they have access to those, can they send them questions?
Yeah, so yep, just along the lines as I had kind of shown here with our, if we scroll down here, so you'll be able to see the notes for different things. So here in this case of this office visit, I can see it. If I had a surgery case, I'd be able to see the information there for follow-up, as well as like educational materials were available here in our after visit summary. So those will all be right there for you. And then if you have a question about something on it, you're able to, not from, I don't think it's from this page. Yeah, from here, you're able to, if you have any kind of missing information incorrect, you can submit that request from here, as well as from our message center. You're able to ask questions around things from there, and it'll be routed to the appropriate provider for that.
Really cool. Now, if somebody accidentally deletes that email or that message, can they get that back or is it gone forever?
Yeah, so you do have the ability to restore a message. So I'll actually just delete this message here real quick.
I say
And
that because I could see myself doing that.
I do it all the time. I actually just deleted an email the other day for an item I was returning to like,
Mhm.
Amazon or something and didn't have the little barcode. I was like, what do
Oh
I do?
no.
Luckily they were able to figure it out.
Good.
But yeah, from here I can hit this restore deleted messages and it'll pop right back up here
Oh, that's
inside within my
fantastic.
message basket. And then if you do have something you delete it permanently and you can't find, you can always reach out to us and we can help you to either locate it or get the information that you're needing.
Wonderful. That's really good to know, not only for all of our patients listening, but also for myself as well. So thanks, Brendan.
No problem.
So we have some really cool tools that we can utilize as well. And these are kind of interesting. One's called Care Everywhere, and the other one is called Share Everywhere. Could you kind of help us understand what those are and what they do for patient care?
Yeah, so Care Everywhere. So as I mentioned, that we have another organization linked to our medical record or MyChart account throughout this webinar today. That's what Care Everywhere is. So that's what's indicated by this little, however you can't see it, this little E icon here on my screen that you can also see up here. That is Care Everywhere, and it just kind of lives in the background once you're linked to an organization, and then you'll be able to see that information right here. So I can quickly see, I have two, of course, this is just another test environment we have, so it's also Phelps Health, but I can quickly see here how many notifications I have from that organization. And I can click this button here, and I'll get the ability to jump over here and log into this MyChart page as well. So here we are in here. In this case here, it's just an overdue vaccine and a balance. This is really more just to demonstrate care everywhere doesn't actually know good information here. But yep, that's right there on the page, and you'll see that kind of just embedded throughout. You'll see that little E pop up on different things. Like if I go to test results, for example, you'll see, here's this, COVID test from another organization with a little E icon. And if you hover over it, it'll tell you where it's from as well. If I go to messages, I can see here I have a message from another organization right here as well. So that's all throughout the page. And then Share Everywhere. This is a tool where if I have a chiropractor I see, right? And I wanted to share with them, my x-ray information. I, as a patient, can go in here to MyChart and go to your menu. And once again, if you go down here, it's in that same place, with the share my record down. If my scroll works, share my record, share everywhere. It's all right here, but you can also search for anything up here at the top with text. So if I click on share everywhere, though, I'll get brought into this page here, and then I'm able to enter in the name of who I want to share my record with. So we're just gonna say test, and I can request a code. And then this code here is good for the next 1 hour. So at this point, I can have them go to shareeverywhere.com, and they'll plug this code in here and their name, and then they'll be able to get access to an overview of my medical record and be able to see some information from Phelps Health right there within it. So that's a really convenient tool for, different cases, or maybe like the school nurse, for example. You need to share immunization history with them for something. You have the access, you can do that from right here. So it's a very convenient tool that's easily available and for everyone.
Awesome. Great. Thanks, Brendan. So I have a couple of other a little bit generic questions I'd like to ask as well. How does Epic help transform care for patients? We know that we already have really great high quality healthcare here at Phelps Health, but how has Epic helped transform that even more?
Yeah, so Epic, it really gives us the tools to empower ourselves to go to kind of the next level, if you want to put it. We're able to pull in information from many other, healthcare organizations. So say you had a visit, in St. Louis, we're able to pull those records right into our system to help make up-to-date informative care. We have tools that kind of help us to more quickly find, diagnose and find, solutions to issues going on. We have access to up-to-date information from many different medical record or medical dictionary type publications and stuff with up-to-date treatments and that sort of thing. It's all easily available to us right here in our system. And with the new system, right now things are a little bit slower as we're kind of getting established on it and learning the system, but over time it'll continue to speed up and pick up, and it's going to help us to kind of promote a better outcome for our patients because of new information available to us, as well as like tools like MyChart. As a patient, that really enables you to be involved in your healthcare because you can see, like things like e-check-in, for example, with the questionnaires we complete, you're able to provide accurate information there that flows over into our system. So when you're in the office with us, we're able to quickly pull that information up and reference it and, help to make informative care decisions. So it really is just kind of a big collaborative amount of different information available to us that really just helps to improve our ability to take care of patients.
Awesome. I think that's a really spot on answer. I know I feel really empowered as a patient. It's really cool to go in and see my information and see how it's changed over the course of a few months or a year or whatever it is. I think it's really awesome. I think it's a huge game changer. So one more question and then we'll have a polling question and wrap up. Who do patients contact if they have questions about Phelps Health MyChart?
Yeah, so depending on your question is, if you just had like general questions, we do have a phone number that we'll show here in just a little bit that you can contact, as well as an email address you're able to write to. And if you're in MyChart, you can always go to the messages section here and then ask a question as well. Oops. If I click the right healthcare organization, ask a question on, and I got logged out. But you're able to ask a question in there and that will route to us. So you can ask a customer service question. And now that I messed with my authentication settings, I need to verify I am a real person again. So everyone's
While you
favorite
do
game
that,
of
that's
pick the pictures.
I am really terrible at this, Brendan. I am probably
I
one of the
am
worst.
too.
It takes me like 6 tries.
And it's like, you sometimes it likes to play tricks on you. It's like, pick the stoplights, for example, or
And the
traffic, at
stoplights in
least
three
traffic lights.
boxes.
And yeah, exactly. It's like, well, does this corner of the traffic light still count? Yeah, I don't know.
Uh,
But here from the messages tab, I can go in here and I can ask a question. And I think I actually changed healthcare organizations. Yes. So then I can say customer service question, and I can say, if I have a, website issue or a complaint or a compliment or something along those lines, you're able to enter that in and then send that message and it'll come to us to quickly respond. It's actually the same people triaging those that will also be on the other end of the phone calls and emails. You can always ask your provider's office too for information.
Awesome. So one question that just came up in my head, looking at this, I know we have a couple of different options that we can choose from regarding whatever the question is for customer
Mhm.
service, but is it best practice to just be very generic or to have really detailed information whenever we send in that request? What's best?
Yeah, so there is no text limit. Of course, the more information is going to make it easier for us to be able to
Yeah.
answer your question and get back to you quicker. But if you just need to get assistance with something, you can always just say, can you please contact me and provide us a phone number or something, and we'll reach out to you. But the more information you're able to provide ahead of time, the easier it will be for us to be able to quickly provide you an answer. But it's really what's easiest for you as a patient to write to us.
Perfect. Awesome. Thanks, Brendan. Unless there's anything else that you would like to show us in Epic My Chart, I am ready to do our last polling question.
Yeah, I don't think there's really anything else right now to kind of go over. I mean, we kind of went over a high overview. There's a lot
Mm-hmm.
more, and you can kind of click in here and explore as well to your menu. Various different pieces of information are available here. I definitely encourage you to go out there and take a look at it and kind of just feel your way through the different menus and get an idea of what's there, because you'll be surprised at what you'll find that is available that you were like, oh, I could never do this before. But it's definitely a very feature rich system that's available. But I don't think we have anything else really kind of high overview to show. So
Okay, perfect. Awesome. Well, I am going to go ahead and share my screen and stop yours. All right, awesome. I'll leave this popped up, but we're going to go ahead and do one last polling question. And this is regarding like the next topic that somebody would like to hear about. So we have a few different options here. I'll leave this up for about 30 seconds. I know today we covered Phelps Health MyChart, but if there is something that's maybe not on this list, you can go ahead and choose a different topic and submit that in the chat box as well. Give it about 10 more seconds. All right, we're going to go ahead and end the polling and I'll share those results. They were pretty cool. So we have a few different topics that we've never covered before for the scope at lunch. So this is really cool. Thank you everybody for participating. And I've just got a couple of extra things to read off and then we will be good to go. So for questions about MyChart, you can email mychart@phelpshealth.org or you can call MyChart patient support line at 573-458-7550. Again, that's 573-458-7550. Thanks so much to everyone for tuning in to the Scope at Lunch. A huge thank you to Brennan Williams for giving us a really thorough walkthrough of our new patient portal. We really appreciate all of the insight that you've been able to share with our community, and we're super looking forward to utilizing this new resource. As a reminder, the show has been recorded and will be emailed to all participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you like the show and would like to know more, check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day, everyone. Thanks so much.